In this lecture, we're going to look at an introduction to the vertebral column and intervertebral discs. Now, the vertebral column is the backbone or spine, which is built up of 26 individual vertebrae. Now, there's 5 vertebral regions. There's the cervical vertebrae, which is in the neck, and there will be 7 cervical vertebrae. There are going to be 12 thoracic vertebrae, and this is found in the thorax or rib cage region. And then in your low back or lumbar region, we have the lumbar vertebrae, in which case there are 5 lumbar vertebrae. And then we have the sacrum. The sacrum contains 5 fused vertebrae, and then the coccyx or your tailbone, you'll find 4 fused vertebrae. Now, going back up to the cervicals, thoracic, and lumbars, the way we name these is we number them. And if you see here, in the cervical region, 1 through 7, we say that this is C1, C2, C3, and so on. In the thoracics, we have T1, T2, T3, all the way down to T12. In the lumbars, L1 through L5. And then the sacrum, even though these are fused, we'll still call them S1, S2, S3, and so on. And then the coccyx, well, the C is already taken by the cervicals, so we call it CO. Okay, so CO1, CO2, etc. Okay, how do you remember these? How I remember it is I get up and I have breakfast at 7, lunch at 12 noon, and dinner at 5. So breakfast, lunch, and dinner, 7, 12, and 5. Now the vertebral column is going to support the weight of the head and the trunk, and it helps to protect the spinal cord. It's going to allow spinal nerves to exit the spinal cord, and it also provides sites for muscle attachments, and this helps to permit movement of the head and the trunk. The intervertebral discs are going to be found between adjacent vertebrae, and it's going to help in absorbing vertical shock. And it's going to permit various movements of the vertebral column. Now, it's made up of fibrocartilaginous rings. With a pulpy center. The rings are known as the annulus fibrosus. That pulpy center is known as the nucleus pulposus. I want you to kind of think of this as, you know, some of the inserts you have for shoes where it's a nice foam that is going to help cushion the foot, but then maybe right in the center of the heel area, you're going to have this gel, which just gives a little bit of extra shock absorbency. Well, that's pretty much how the intervertebral disc is made. Now, the annulus fibrosus is going to be made up primarily of fibrocartilage. Okay, and the thing about the disc is that it also will absorb quite a bit of moisture. Now, at night, when you're sleeping and you take the weight off of the vertebrae, you tend to grow a little bit in length. Have you ever noticed where maybe in the morning you have to readjust your mirror on your car, and maybe later on in the evening you wind up, maybe after work, having to adjust the mirror again? And that's because throughout the day, because of that compression of the vertebrae, you start to push some of that moisture out and you shrink a little bit. And again, at night, you're taking the weight off of the vertebrae and you're imbibing or pulling in more water, basically, into that disc, and you might grow a little bit. And so looking at an actual intervertebral disc, again, we see the nucleus pulposus in the center and the annulus fibrosus creating the intervertebral rings. Okay, so this would be a normal intervertebral disc. Now, what can happen with stress on the spine, such as twisting and bending and lifting things incorrectly? We can start to create little tears in this annulus fibrosus. As the tears occur, because this is kind of like a gel, like I said, it's kind of like some thick snot, it'll start to work its way through the tears in the annulus fibrosus. Eventually, it can herniate out. And when it herniates, it can then compress on a nerve. And that can cause quite a bit of pain, numbness, tingling, or loss of function to the area that's being compressed, to where that nerve is going to, that's being compressed. And so we call that a herniated or slipped disc. I don't like the term slip disc. It's a misnomer. The proper term would be herniated disc. And again, this is protrusion of the nucleus pulposus. It most commonly occurs in the lumbar region just because of all of the weight and compressive forces in that region. Another thing is because of basically there's some transition areas within the lumbar and sacral region that also tend to lend itself to a lot of excess stress, which again can start to tear at the annulus fibrosus, allowing the nucleus pulposus to herniate out. Now, these can occur anywhere, and I've had patients that have had cervical disc herniations. Again, these are horribly painful, usually in the neck. In the lumbar, they can cause pain, again, numbness, tingling, loss of function, as well as in the neck. But typically, though, you'll find these more in the lumbar region. And it just depends on where this nucleus herniates at. If it herniates at a region like you see here or in the previous picture where it's compressing a nerve root against bone, then you're going to have symptoms. If it herniates maybe anteriorly, well, there's nothing really there to compress, or off to the side. Matter of fact, pretty much anywhere in this area, it's not really going to cause a problem. If it herniates straight back and it compresses the spinal cord, now that can be a surgical emergency. And here on an MRI, we can see an example of a herniated disc. Now, we're typically not going to see a herniated disc on X-ray because this is all soft tissue. And the X-ray is just going to go right through, and you're not going to see it. You can get a hint that there might be a herniated disc because of the signs and symptoms. And on X-ray, if you kind of measured the intervertebral disc height, you might see that that these bones are closer together than they should be. But that's not always the case. In this case right here, that's pretty normal looking disc height, but the herniation is taking place back here. So you really need an MRI to make that definitive diagnosis. Now, looking at normal curves of the vertebral column, we're going to have primary curves and secondary curves. The primary curves are the thoracic and sacral curves, and they're formed during fetal development. And so you can see as a fetus, you're kind of curled up, kind of C-shaped in the womb. Okay, and so looking at the mature spine here, we have a cervical curve that dips inward. We call that a lordotic curve. We have the thoracic curve that bows outward. We call that a kyphotic curve. In the lumbar region, we have another lordotic curve, and in the sacrum, a kyphotic curve. Now, an excess lordotic curve, we would call that a lordosis. An excess kyphotic curve, we would call it a kyphosis, and so on. But if we take a look at the shape of the fetus, C-shaped, so which vertebrae over here are going to give us this shape? Well, it's going to be the thoracic and the sacral curves. Okay. Now, the secondary curves happen pretty much throughout the rest of the development. Basically, when the infant starts to raise their head and the neck muscles become stronger, then they're going to develop the cervical curve. And then as the baby sits up and then is able to stand and start walking, then the final curve, this lumbar curve, is going to form. Okay, so the primary curves again are the thoracic and the sacral. The secondary curves are going to be the cervical and lumbar.